This is a video just describing how to change an Elocon dressing. You can do this at home or you can do it in the hospital. It's slightly different for when you're in the hospital up to when you're at home, but we'll cover both. So the equipment that you need is the Elocon ointment is better if you can get the ointment. In hospital you'll need sterile gloves, but you don't need sterile gloves at home, a bandage, a non-adhesive dressing, a sterile scissors and some other gloves. So the first thing to do is pop your gloves on and then undo the bandage. So when you do this at home, you will have washed your hands thoroughly, okay, and you would have cleaned the tray thoroughly as well. So if you're at home, you can use like a kitchen tray. A plastic one is better, and then clean that thoroughly with hot water and detergent, and just make sure that your hands are really clean. So you discard the bandage and carefully, you can hold the PICC line if you want, but carefully take this dressing off. You can see that it's slightly red. So for nurses in the hospital, when you see this kind of redness, this is a classic example of when the Elocon cream can be used. So when you're at home, you would now put on another pair of gloves and dab on the cream on the areas where it's red, but keep away from the exit site if you can. But if you're in hospital, we've got some sterile gloves, so we're going to use the sterile gloves. So what we do is we open the sterile gloves, we put a little bit of the cream onto the packaging. You should use this sparingly, don't put a huge amount. And if you're a patient having this, make sure that you bring back the cream with you to hospital so that we can do it in hospital if we need to. So always bring it with you. So pop on your sterile gloves. But then if you're at home, you don't need sterile gloves, as I say, and you just need to use your other gloves. If you can't get your gloves on, don't worry if you're at home. Wash your hands thoroughly and then you can just put the cream on without gloves at all. So you've got your sterile gloves on in the hospital, so just put this sparingly. Avoiding the exit site if you can. Don't come too close to the exit site. I'm going to lift this up with this hand and I won't do any of the cream with that side. Sometimes you get much more redness than this, and then you can apply it to the whole area. Okay. So obviously if this site needed to be cleaned, you would have done that before the chlorhexidine. But the patient, you don't have to do the cleaning at home, just the cream, okay? And the nurses will do the cleaning of the exit site with the chlorhexidine in the hospital. Okay, so now you take your sterile gloves on, or if you didn't have gloves, then that's fine. So if you're in a hospital, put on a pair of non-sterile gloves. They need to open the packaging of the non-adhesive dressing, so only this non-adhesive foam dressing. You can get different types, so open that up. And either wear some sterile gloves or at home, what you can do is just hold on to the dressing without contaminating it. You can fold. Okay, so this is a sterile scissors, so you mustn't touch this end of it, take it out of the packaging. You mustn't touch the dressing, so just cut the dressing just to the middle, like so. Okay, and then hold on to it with your edge, and then pick the line up carefully and put the dressing underneath. Okay, take your time so that this doesn't rub against the skin. And then what you do is you put the bandage on. Okay, so lift your arm up for me, please. So make sure there's a nice loop in the PICC and there's no kinks, and then you just put the bandage around. make sure it's all covered. And you can put a sleeve on top of this then. You need to make sure that this is taped down with tape and then a sleeve on top of it. Okay, and there we are. So do that every day. Make sure you wash your hands really well, and make sure that you've got an appointment at the hospital to review it.